Okay, hi everybody. Welcome to this Coventry HDRC webinar. Delighted that Jessica Allen is joining us to present from the Institute of Health Equity. So we're just getting the slides sorted, and once we've done that, we will kick off. For the purpose of these webinars, we do have everybody on mute to enable the recording to be clear, but I do believe you can type things in the chat. Okay, so I'll hand over to Jessica. So Jessica is the Deputy Director at the Institute of Health Equity, which is part of the Coventry Health Determinants Research Collaboration. And I know, Jessica, I think you've already done a couple of webinars, haven't you, for Coventry HDRC, which is great. And in this particular one, we're really interested to learn and share from the work that the Institute has done around the relationship between transport and health. So yeah, really great to have you. Jessica, what do you prefer to, do you want to present and then take questions at the end, and I'll keep an eye on the chat and see what's coming through. So
probably, yeah, I think that I shouldn't be too long with the slides. And but just to flag that I've got lots of questions actually about what you think about inequalities in access to affordable transport in Coventry. And although we've been working with you a long time, it's not really an area that we've explored. So I'm really interested in hearing all your thoughts. But I'll just start because we've got some new data on inequalities in health across England. I'll just run through that because some really concerning trends.
yeah.
We're also working with Scotland and Wales. So I've just included this because it shows the trends in life expectancy for each of Scotland, England, Wales and Northern Ireland, and England in black there. That's female. The solid line, dotted line is male. And you can see we're really struggling to see any improvements in life expectancy. They declined through the pandemic. They haven't really recovered. And since about 2010, life expectancy's been relatively stalled. So concerns there. And in Wales, actually, you can see some, where we're working some declines as well. Next slide, please. Healthy life expectancy, it's even more concerning. That's how long you can expect to live in good health. And you can see again that since 2013-50, declined everywhere across the UK, particularly steep in England and Wales, and been declining continuously in Scotland since 2013-15. So that means that people are getting unwell, more likely to get unwell earlier. There are huge inequalities in healthy life expectancy as well by level of deprivation and among some groups, but deteriorating for everybody. And therefore the gap between how long you're in good health for and your length of life is increasing. So people are spending increasing periods of time unwell, and what that means, not just for the individuals and the families and communities, but also for the demand on services, and the kind of orientation we need to make. People getting sick well before retirement age as well. You can see here in Wales, for example, on average, so it's going to be much lower healthy life expectancy in more deprived areas. It's well below 59, so people likely to be ill from around 58, females. So what does that mean for working life and economic productivity and so on? Next slide, please. And here's life expectancy in England, just another graph. You can see the big drop in life expectancy, pandemic, and the recovery since. So it's recovering, but it's not fantastic. And we're recovering more slowly than lots of other similar countries. Next slide, please. Healthy life expectancy. Next slide, please. And you can see here, these are inequalities in healthy life expectancy. So they're increasing for both females and males. That means inequalities in health are widening, not just in life expectancy, but in health. And we know that that's particularly the case for women. So women in more deprived areas have seen some really significant declines in their health and in their life expectancy, particularly since the pandemic, but also since 2010. And there's some feelings that that's around caring roles, the double burden, if you like, of work and caring and just the impact of carrying the cost of living crisis in families. Next slide, please. And I know I've presented with you before, so you'll have seen this slide showing the uptake really in working with us. And it's been quite remarkable since Coventry began first place in 2013. All these other places and regions and Scotland and Wales have joined. We've learned a lot from the work that's happened across Coventry. There's a lot of evidence now emerging from Coventry about what's worked, what's not worked, what the challenges are that's feeding into all these other places. But we've now got experience of working in all these different contexts, in rural areas, in remote areas, in big cities, in towns, all kinds of different political contexts. So I think we cover the whole political spectrum now, including Plaid Cymru in Wales and the Scottish National Party and Reform. So there's a huge range of experience within all these places. All these places, of course, have wide inequalities within them. And they all tend to, when they work with us, tend to prioritise 2 or 3 particular areas. And we're increasingly finding, actually, I was just thinking about that when I was putting these slides together, that transport's increasingly being flagged as a major social determinant of health, so a major factor in shaping health in all these places. And that wasn't necessarily the case in the earlier period. So it was helpful really to have to be able to think about that in the context of the work that we're doing, covering nearly half of the UK population now, about what that might mean. And there's opportunities, of course, for improvement. Thank you. We work to these 8 principles, and again, you'll be aware of those, of course, in Coventry. So we start with the very earliest years. And I want to just make the point that transport is, of course, impacts differently across the life course. So families with very young children can be particularly stuck because it's without affordable, good, regular transport, because it's very difficult to take children on transport quite often. Young people very much affected by the cost. Well, everybody very much affected by the cost, but young people in particular don't have access to cars often, and all the impacts that then has on employment and work and education and skills. And obviously, as people age, more difficult to use lots of forms of transport. People with disabilities, there's discrimination that happens in public on transport systems. So we try and think through all the lens of transport through all these different lenses. Just to note that when we do cover transport, we usually put it in number 5, create and develop healthy and sustainable places and communities, but it does impact in all these other principles. So just as a pointer to where we might locate it, but it impacts across the life for all different groups of people and in all these different contexts, rural, urban, etc. Thanks, Harmony. Next slide, please. I think I've probably covered that. So how is transport a determinant of health? Well, there are direct health impacts. For example, if you are cycling, walking to work, what's known as active travel, and you have access to the means to do that and the safe routes to do that, it's obviously very good for physical and mental health. So that's obviously a direct health impact. And we know that uptake of active travel, there are inequalities in that. There was a big programme in London where they spent a lot of time working with some ethnic minority young people who weren't cycling, weren't using bikes at all, and they worked specifically with them, and there was a big impact and a resulting uptake in cycling in those groups who were using it less. And more deprived people tend to walk less, tend to use bikes less, etc. So inequality is directly related to that. And also just the stress of using public transport. We all know that the waiting for the buses, the delays, the cancellations, the cost can have direct impacts on mental health. So if you have a car, it can be much less, I mean, obviously there's congestion and frustration and parking, but can be less stressful than using some public transport routes. So there are direct ways in which different forms of transport impact directly on our health. And then, of course, indirectly, there are huge impacts on health and on those other social determinants of health. So access to services, healthcare, of course, but a whole range of services affected by transport and good quality and affordable transport. Also impacts on the cost of delivering services. So don't want to forget about that. We know about, for example, carers going out to people's homes and the additional costs of travelling to remote or difficult locations to access, but there's a whole range of services where that is also actually more expensive to deliver services. And in Scotland, where we're also working, the islands and remote areas of Scotland, they have additional weighting provided to in service resource allocations because of remoteness, rurality, islands. It's much more expensive to deliver services, of course, in some of those remote and island locations. So that will apply also across England. We hear lots of reports about rising levels of absence from schools. That's been a marked feature of some of the impacts of COVID and children not attending school. And of course, one of the reasons for that, one of the blockers for that, is the transport to school. It's expensive, it's not necessarily regular, children can't necessarily access the routes can be indirect, etc. And then the last bus might leave at 5. They don't have access to the after school programs. To get to FE colleges can be 2 or 3 buses in some of the areas we're working that don't join up. So there's lots of barriers, of course, to education and, of course, to employment. Leads to social isolation and loneliness. I mentioned, for example, families with young children earlier. They don't have access to the baby toddler groups and so on. And there's lots of isolation among that cohort, actually, young parents, as well as for older people. And of course, unaffordable transport, major contributor to poverty, which has all the other impacts. There are more indirect ways in which transport affects all of our health than this, but this is just some indications. And again, it would be interesting to think this through in the Coventry context. Huge inequalities in all of these. And just to note that in 2021-22, 1 in 4, well, nearly 1 in 3 of the poorest fifth of households don't have access to a car. So major inequalities, of course, in who can access private transport and who is using public transport much more. Thank you. Let's move to the next slide. So, of course, where there is public transport in place, there's barriers to accessing it and the impacts on services and employment, as I've said. Young people make fewer trips than older people. People in lower income households have much less mobility than others. Over half of the working age population live in areas with low public transport access to jobs. Over half. I mean, that's quite a large proportion, obviously. And then there's barriers in access to healthcare. I could go on. 20% of unemployed people in England turned down a job or did not apply for a job due to transport problems. So, transport is a significant determinant of health in all kinds of ways. We also know that perceptions of safety, and we've heard reports that families with children with autism spectrum disorders or behavioural issues or learning disabilities don't use public transport necessarily because they fear their children are seen as disruptive or badly behaved, and there's a lot of kind of shaming and stigma associated with that. So there's barriers that way as well in terms of accessing what transport there is. Thank you. And then there have been all the cuts to public transport outside of London. So I will remark that London has a remarkable transport system, and I'm sure you're well aware and have used it, but it's completely different to other cities. And the Mayor of Greater Manchester obviously has brought in all the public transport in-house in Greater Manchester and done an enormous amount in terms of subsidising transport for young people. He was aware that young people who didn't live directly in the city of Manchester had never been to the city of Manchester, had never taken up all the opportunities, all the free stuff that happens in Manchester, leisure, social, but also training and skills and so on. So made transport available, I think it was free, for young people to reach into the city of Manchester and access some of those opportunities. So Manchester and London aside, probably, bus services halved between 2008 and 2025, and in some areas that was even more. So there was absolutely enormous cuts in access to bus services, and of course buses are used much more by those in the lower income households than trains, for example. So really significant cuts which have had enormous impacts. Next slide, please. Has the Better Buses bill in October is probably positive news, although we all know political turmoil and whether this actually is felt in reality. But in that bill, it was said that passengers will be protected from cuts to crucial routes, however defined. There will be training for drivers, bus drivers, train drivers on antisocial behaviour. Really important. Again, that there's a lot of fear around young people. Antisocial behaviour on buses puts people off using it, of course. And more power in the hands of local authorities to decide what works best for their communities. And that third point is really important. But I would also add that it's really important that communities decide what works best for them. And some of the areas we've heard of great community transport schemes, which have been really positive, and the community voluntary sector organisation with support from local authorities at times, getting access to buses and providing transport, make a call and they'll come and pick you up. But it tends to not be very well used. So there's trying to understand why that might be. There's probably issues around awareness about it, or they're just not providing the transport in areas which need it, or it's not kind of on the right routes and so on. So lots of issues about how you can involve communities. So although we've got power in local authorities, there's now a job to do for the local authorities to divest themselves in a way of the power to decide what works best for their communities and hand to communities around these issues. Mentioning clean air zones as well, which are crucially important, and we already see measurable impacts on health in London in terms of respiratory disease and other impacts, which are fantastic, obviously environmental impacts as well. So very positive for health and inequalities in health. Potentially they increase economic activity and footfall. You see, pedestrianised zones and stuff that's really popular. People like using them, but there are big opposition to any restrictions on public transport, of course. So we really need to reframe the debate to make sure that we bring people with us in these endeavours, because there's such opposition to traffic restrictions. And I'm sure you've experienced this in Coventry a lot. That it can really undermine the whole agenda. And I don't think the case is very well made about pedestrianisation, public transport, active travel, etc., etc. There's a health case, there's an equity case, which is really poorly made, actually, and probably an economic case. Next slide, please. So just some thoughts about ways forward, and I'd be really interested, as I say, I mean, many of you will have direct experience of all of these issues, especially in Coventry, but more broadly, it'd be really interesting for me to hear your thoughts as well. So how can we encourage active travel, and specifically thinking about inequalities in uptake of active travel, integrating transport networks, of course, that's often crazy lack of integration. I mean, we've all seen those things with bike routes ending in a brick wall or something and just totally, or joining a major road. So there's obviously a lot that could be done around integrating transport networks and encouraging active travel. The bus infrastructure, we're in Oxfordshire and we were hearing about some of the bus stops. There's no good route to the bus stop. You have to walk through a field. It puts people off. It's uneven ground and muddy, or there's I mean, these are rural areas, but it's very overgrown. It looks terrible. Makes people very nervous about being around in that environment. Affordability, of course, absolutely critical. Some of the prices so high make for all the reasons we know, but how can we encourage reductions in cost and even free transport, as I mentioned, the Mayor of Greater Manchester. We've seen examples where employers in some areas have put on transport. So, for example, working in Northumberland, rural and isolated households, our villages and so on, seasonal work in farms and tourism, and the employers have laid on transport, and it just overnight, gets rid of all those barriers and the cost. And they just have a bus that they go and collect people. Community transport, I've already mentioned, it has to be designed with communities. And we've heard from West Norfolk, where we work, and again, this is a rural area, so it may not be relevant for Coventry, that when something goes wrong with a car, it's incredibly expensive. People then are stuck. They literally leave their jobs, leave school at that point and can't afford the repairs, or there's a big gap in something going wrong and being able to get the repairs done. And at that point, their employment is ended. So are there mobile ways of providing mobile car repairs, etc.? There could be some creative thoughts around that. I haven't got mentioned parking because I know that's always a very fraught area, but I'm thinking more about public transport, I guess, and how we can make that a contributor to good health and health equity. So very interested to hear your thoughts. I think that's my final slide, Harmony, is it? Oh, I've made these points. But important to note that when we think about the costs of doing any of this, and of course there are enormous costs of doing nothing. So we repeatedly make this case. If things were to stay where they are, we're losing people to ill health, to unemployment, lack of education and training. That has enormous costs to families and households and whole communities, but also to services. Have to pick up some of the crises that result, mental health crises, physical health crises, but also poverty and so on. And this point about public political support, transport is so controversial. And I'm reminded that when the Mayor of London introduced the congestion charge and so on, there was enormous opposition to it. And there was a subsidy in place for people who had cars of a certain age, but there was no kind of equity waiting for this. So it was a blanket charge and was felt much more acutely among low-income households. And then as a result, and it was obvious because equity wasn't built into the congestion charging and the clean air zone and so on. So if you have a flat tax, it's inequitable. So how can you make sure that equity is a consideration at the start? And as a result of the inequities that were resulting from the congestion charge, there's still is huge opposition to it, which I think can easily be mitigated by putting equity first in the kind of approaches to managing some of these efforts to improve transport and clean air zones and so on. I will stop there, I think. Thank you very much. I see there's lots of comments in the chat. It would be great to hear them. Thanks, John.
Thanks, Jessica. Wow, what so much to cover there. So well done. Massive. Could be a whole module, couldn't it? Easy. Yeah. So thank you very much. So I think we'll thank you everyone who's engaged in the chat. It's probably one of the livelier discussions. So I think Jessica, you've definitely stimulated thought and discussion, and I think some of the key points that have come out for me is really reinforcing that transport, of course, can contribute to a lot of inequalities in a place, but also I think there's a lot of positives and opportunities there if you get things right to really help people in their life chances. And I think the point you said, Jessica, about it is something that can help people, and it is really important from when babies are born through young people, working life, and older people. It's really important, and I think we've also heard it's really important that we bring and work with communities when developing transport infrastructure. And there's also something about individual agency and people's ability to utilize transport infrastructure and making sure that it's affordable and equitable for all. And I think a lot of learning from other places as well. So I think we'll take you up on your suggestion there, Jessica, about working with the institute on this and bringing in some of the Coventry colleagues that have been on the call. And as I say, we've got some interesting work in the pipeline and in place, looking at evidence and data. And if anybody does want to know a bit more about Coventry HDRC, yeah, I'd encourage you to go on our website, Coventry HDRC website, where you can sign up for our newsletter. And there's also we're always adding new information on the website about the latest projects, including things to do with transport, etc. So, yeah, thanks again, Jessica. It's been really insightful. I don't know if you've got any final things you want to say. Anything from UCL? Any publications relating to this?
So we're touching on it in lots of the work we're doing with places. I'd be delighted to be part of any kind of group thinking around transport as a social determinant of health and what can be done about it. I think there are opportunities locally. It's one of the areas where there is stuff that can be done. Lots of good suggestions in the chat. I'll just end with an example from Bogota of how completely transformative the transport can be. So a bit out there, but there's a slum area up on a very steep hill just outside Bogota, huge, desperate conditions, very high rates of crime, poverty, etc., disease. And they put in a cable car that went from this slum, and they put it in based on what the occupants felt was important, and it takes people down into the city centre, and it has absolutely transformed the lives through employment, crimes dropped. It's just been a completely transformative intervention. So I'm not saying we need one of those cable cars, but just there are huge opportunities through better improved transport. Even it's been in the chat, cycling proficiency in school, that kind of thing. There are ways to really take this forward. Thanks.
Yeah, need to go forward on those innovative ideas for sure. So yeah, thanks a lot. Thanks everybody. The presentation will be available, the slides and this I believe will be on our YouTube channel. So yeah, thank you everybody, and keep in touch for the next webinar. Okay, thanks Jessica. Thanks everybody. Bye bye.